accepted yet. Steve's supporting me today, so he'll do that.
Thanks, Steve. Right, welcome to this virtual meeting. This is a formal council committee. The proceedings will take place live on the internet, and the meeting will be recorded for future viewing. It will assist the conduct of the business if participants speak when invited. Members of the public are welcome to view the proceedings, which should not make contributions until they are invited in line with our procedure. All participants should mute their microphones and turn off their video feed when they are not speaking. Please remember to unmute your microphone and switch on your video feed when it's your turn to speak. Speak clearly and slowly into your microphone, and anyone wishing to speak should indicate using the raise your hand button on Microsoft Teams. I'll invite people to speak at the appropriate time. If you don't have a hand button, please type your request in the chat function and Helen will pick that up for us. I ask for everyone's patience with the use of technology, and I apologise in advance if we do experience any unforeseen difficulties, which we shall try to resolve expediently. I shall now follow the items of business as set out on the agenda. Are there any apologies for absence, Helen?
None from members, Chair, but I have received an apology from Neil Buckton today. Okay, thank you. Agenda item 3, to report the appointment of any subs. That's not appropriate. Number 4, to receive any declarations of interest under the Members' Code of Conduct.
Yes, Chair, Steve Walthour here. I always declare that I'm the nominated representative of the council on the Dudley Group of Hospitals Council of Governors. It's a non-pecuniary interest and it's a non-decision making body as such.
Yeah. Thanks, Steve. Who else is that? Peter?
Yes, thanks, Chairman. I use a diabetic screening system, so I suppose I ought to declare that, really.
Thanks. That's Councillor Peter Miller for the record. Just as a matter of course, I'll declare that I'm Chair of Trustees of Dudley Mind. As there's an issue with mental health, that'll be on as well. Jane.
Hi, yeah, can I just declare that I'm on the board for White House Cancer Support and Lunch on the Run?
Thank you, Jane.
Thank you.
Any more declarations of interest? No? Right. Agenda item 5, to confirm and sign the minutes of the meeting held on the 27th of January 2021 as a true record. Can I sign those as a true record?
Yes, Chair.
Yeah.
Thank you. Thank you very much. Agenda item 6, a public forum. Helen?
I can't say that there is anybody here from the public, Chair, but I will just ask, is there any members of the public in attendance that wish to raise any items?
Well, we take that as a no. Thanks.
No, Chair.
Okay. 6, Matt Boucher. Do you want to come in, Matt? Have you anything you want to tell us?
Evening, Chair. We haven't scripted this at all, have we? So I just want to advise the committee that this afternoon we participated in the Langham Buisson Health and Social Care Excellence Awards. We were shortlisted in a national category for excellence in the response to the COVID-19 pandemic in adult social care. Good news, bad news. Good news is we finished top of the pile in terms of local authorities, but unfortunately we didn't win the award. That went to a small domiciliary care organisation in mid Wales for the work that they have done. But nonetheless, I think it's brilliant that Dudley has achieved this. I'm very grateful to all the staff and our care partners that have been involved. And great to get us on a national stage after all the work of the last 12 to 14 months that the committee's played a key role in overseeing. Thanks, Chair.
Thanks, Matt. Do any members wish to pass comment on the work that Matt's team have done over the last 12 months during COVID? Kathy?
Thanks, Chair. Yeah, I mean, just to say an absolute big thanks for all the work that the staff have done. You know, that we've said all through this that the dedication, the commitment, and the innovation has been outstanding. And to get to get top of the pile for local authorities, even if we didn't win an award, is an absolutely fantastic achievement, and is just, you know, should be real recognition for the work that our staff have done in going above and beyond all through the pandemic. So thanks to everybody.
Thank you, Kathy. Peter Miller.
Yeah, more or less the same comments. Thanks to all the staff for the wonderful job they've done in the last 12-14 months for helping keep us safe and well in Dudley. Thank you all very much.
Thank you, Peter. Alan Hopwood.
Yes, Chair, much the same. A big thank you to everybody that's been involved, all the officers, and might I say it's been well chaired as well. So thank you very much indeed.
Thanks, Alan. I don't think this one's anything to do with me. This is all about the staff in Matt's team and all the work they put in. I think it's outstanding that we've been selected or shortlisted out of 230 that put in for it, and we were in the top 9 and the top local authority, as Kathy said. So brilliant, Matt. Can you please pass on our thanks and congratulations to all of the staff in your directorate, and please make sure that the public learn about this as well, and the rest of the councillors. Thank you very much.
Will do. Thank you, Chair.
Thanks very much. Agenda item 7, local and national COVID developments. Karen, if Karen's with me, I have got a running order, but I've also, I think the officers have got this as well. So if we can try and restrict this to a quick 5-minute update, please, Karen, and then we'll go on, and I'll tell the members the sort of time limit, because otherwise we'll be struggling for time towards the end. Thanks.
Yeah, that's not a problem at all. No, thank you, Chair. And again, absolutely. Can I just say, as new DPH, the work of social care is phenomenal, I have to say, and you know, I've worked with the authorities, so if I could just get the chip in, well done, Matt and the team. In terms of where we are, the situation is overall looking really good. The rates are now 28.3 per 100,000 overall, and 6 per 100,000 for the over 60s for the last 7-day Kate rate. So all moving in the right direction, as it is across the region. Some areas a little bit higher, but generally everything looking really good. And we've only got 3 of our wards which have got higher case rates that are outside the control limits, but things are generally looking really good. I think that just the things I want to draw to Scrutiny's attention is that we now have the local outbreak management plan, which we would like to bring to Scrutiny. It's on the agenda, which is replacing the original 8-point plan against which Scrutiny did that really important exercise. And we've had fantastic feedback from the region on that, with many examples of good practice that have been picked up. Some of the areas that are identified within that plan and that we're focused on at the moment. So one is our approach to local contact tracing, which we've now got local 0, which is really good, and that means we get to know about the details on from day 1 of somebody being identified as positive. We do that contact tracing, and we can go and visit people at home if we can't get a hold of them. So rather than waiting for the national system to try a few times and then get hold of them, we do that locally, and we've got a 92% success rate and completion in reaching people. And what's been really important is because we've got an increased number of cases associated with international travel, which is that's the same across the board, with 10% of our cases are linked to international travel, that we're able to pick up problems from day 1 associated with that travel, and we've been able to resolve those. So I think that's really good. And we're looking at that whole area of work and how we can improve that, because international travel is the thing that we are potentially concerned about in terms of the risk of variants of concern coming into Dudley and other parts of the country. So next one is around testing strategy, that we're encouraging everybody, everybody listening to this call, please do your lateral flow tests twice a week. You can pick them up from a pharmacist. You can get the community collect off from a range of places within Dudley, or you can have those delivered to you. So I urge everybody to please take up that offer. And as a council, we want to be an exemplar in terms of all of our staff doing that testing, and that's important to pick up early if somebody's infectious and then prevent transmission. So the next thing I just want to draw your attention is vaccination uptake. 63% of the population of Dudley have now had their first dose of the COVID vaccination. We are really understanding in detail what our levels of inequalities in uptake are when there's lack of confidence in the vaccine, and we're working with the CCG, with our COVID champions and with community members to actually provide a pop-up offer in Lye and in Brierley Hill. Brierley Hill one's happening tomorrow, and doing work with Tandrusty to contact people and have a really good positive conversation to overcome and allay fears around the vaccination uptake. So we'll be building on that work, but just to give assurance to Scrutiny that we do understand the issues and we're working with them, not just around vaccination uptake for COVID, but looking at long-term around immunisation and vaccination uptake and how we improve that. In terms of outbreaks, we've got 5 in workplaces, 4 in educational settings. I'm pleased to say that there are none in care homes. So key messages for me are that in terms of managing the situation, we are in a good place. But what we need to do is make sure that people continue to take up the testing offer, comply with the rules, in order that we don't get outbreaks starting to happen as a result of opening up. We do expect some, it's going to happen, but I think things are working really well. So I think that's probably all I need to report to you this evening. Thank you.
Thank you, Karen. Any members, any questions for Karen on the report so far? Councillor Kathy Bowden.
Thanks, Chair. Just is there any update on the South African variant, Karen? I mean, I know that you'd asked for members to step forward if the South African variant's detected in the borough, and I know we've had cases around the periphery in our neighbouring authorities. Where are we in Dudley?
So no, we've had no evidence of any cases in Dudley. So there is surge testing happening in both Sandwell and Birmingham at the moment, but we haven't in Dudley. I suppose just one final thing maybe, we will be testing our local outbreak management plan through an exercise later in May, and it may be as part of that we do testing around putting surge in place, but no, we haven't got that. And there's lots of surveillance. All positive cases are now being genome sequenced, so it will enable us across the nation to be able to pick up if we are finding any cases. Thank you.
Thank you. Any more members? No, I think the same sort of question is on the Indian variant as well, Karen, because it hasn't hit our shores to any great extent, but we need to be aware of it, don't we?
Yeah, and that's why it's really important that this is piece that we're doing around making sure that our systems around following about people quarantining and being followed up rigorously and following the rules around the international travel is absolutely key, and that is really complex at the moment, and that's why we're now monitoring any cases that are internationally are linked to international travel in order that we can put every possible preventative measure around those. So again, urge people, please do, if you hear of people who've come in and not following quarantine, that they do follow that quarantine. There is support available, and we're looking at that, how we enhance our welfare support to enable people to isolate.
Okay, thanks very much. Thanks very much, Karen. That's a good report. Thank you. Well, agenda item 9 then, the progress tracker. Sorry, 8, the progress tracker. Right, this was I think this was your invention, Helen, the progress tracker.
Yes, Chair.
Well done, and it was really, really impressive, and to have it in such detail. And I have to say, we're going to finish off this progress tracker tonight. I have to say, I'd like to see all scrutiny committees develop this mechanism for having progress trackers, and then not only us but members of the public can actually see that things are being followed through. Councillor Kathy Bowden.
Thanks, Chair. I was actually just going to say that I think it is really, really useful, and I think it would be really good practice for all scrutiny committees to adopt a similar mechanism. Yeah, I mean, I've got some points I want to pick up. I don't necessarily expect any answers, but because we were going to close off the tracker tonight, there were one or two things I didn't want us to lose. So if I run through them in page order, Chair.
Yeah.
So, page 8, item 132, Ian Newman as Director of Finance and Legal. Now, you know, I acknowledge and thank Matt greatly for the additional money that was passported from adult social care through to the voluntary sector from their budget. But I think it's just worth, we need to keep it on our horizon that was a one-off contribution. And actually, I think that some of the questions we asked of Ian was Matt, that money was found from that particular budget. I don't think we've had a full and frank response on that particular item, nor does it address the ongoing issues of funding within the voluntary sector. My next one was page 15, and that is from, it's a really long item. It's item 160, and that was delivered by Paul Mountford, Head of Planning and Regeneration. And whilst it's marked off as being completed on the 12th of the 1st, I would just like to make the point that I have continually asked at not only Scrutiny, but at member briefing updates, at Cabinet, at any forum where anybody will listen to me, for data on adults who are in training, who have taken up the offer, who have been made unemployed. And we have had some data, but I don't believe we've had enough data on that. So I can't, whilst I could tell you at one point how many people were claiming universal credit in the borough, I can't tell you how many people have been made actually unemployed and how many people the local authority has assisted into adult education in terms of upskilling their for their CVs to look for alternative work. So if that can be kept live. And then page 18, 184, it's a pity Neil's not able to join us tonight, and I do note that some of this might be picked up on page 36 in the Trust's report. But, we're still seeing, or I'm still observing, ambulances backed up at A&E. So what I'd wanted to know was what the current position is with that. So, we were concerned about their ability to offload, triage, and then get ambulances back out in a timely fashion. And I think those were, page 19, number 68. Is there any update following the chair writing to MHCLG and DEFRA? Thank you.
Thank you, Cathy. On the first one, the funding as a one-off, yes, it'd be good to actually note that and see if we can keep that sort of finance going towards the voluntary sector, and not just one particular part of the voluntary sector, because there are other parts of the voluntary sector that do sterling work as well. Yes, to keep the data 160, we can keep that live, because that is an important aspect, and I suspect that a lot of people are going to be struggling to find work after this pandemic is coming towards an end, and that needs to be sorted. And then the ambulances, yes, it is picked up on the hospital pages, and it is around about 95% that they're up at. But we need to make absolutely sure that that's going to continue to be on that trajectory. And as far as a recommendation, I wrote to Emma. I thought we'd had a response back, and it had gone out to everyone, Cathy, on that one.
We had one response from one of the letters. I think there were two letters that were sent, weren't there?
Yeah. Okay. Well, we saw Any responses that we haven't sent out back to members, we'll make sure they're out.
Thank you.
Okay, Steve Waltho.
Yes, thank you, Chair. Kathy stole my thunder a little bit there, and I'm happy that she's done so, and your answer as well on the voluntary sector, because I think I actually raised it at the committee originally. And you know my passion for the voluntary sector. I still do quite a lot with DCVS, and I am very keen that this doesn't get brushed under the carpet now. Yes, I'm very grateful that we've supported them with the extra little bit of money from the COVID grant system, but I do understand that I think decisions could have been made last year on actually cutting the base budget to them as well, and that just must not happen. And part of the thing that I asked for was a complete frank discussion and a review with DCVS around the table when the time's appropriate to look at their requirements and how we can support them, because their value for money, I would think their support is absolutely invaluable to this board, Chair. Thank you.
Thank you, Steve. I think if you look at the recommendation, Steve, it says that an appropriate recommendation be made concerning the need for urgent discussions on the sustainability of the voluntary sector, as well as in relation to resilience from the West Midlands Combined Authority. We've got to make sure the voluntary sector is sustainable. I mean, we've seen AIDS UK go under, and a lot of other smaller charities, I do suspect, will be going under as well. And they play a major part in our communities. So if we can keep one or two of these ticking over, although we close this tracker down, we'll keep one or two of them live if that's okay, members. Yeah, so that's just to receive that. Thank you very much. Agenda item 9, Dudley Group NHS Foundation Trust, Emergency Department Improvement Update. I've got here, who's this? And Karen, I've got you down. Have you seen the timings for this? Right, I've got
Yeah.
you down 15 minutes plus 10 minutes Q&A.
Yeah,
Right.
lovely. Thank you, Chair. So accompanying me this evening is our Medical Director, Julian Hobbs, as well. So we can answer any questions that the councillors may have. So I'll take the paper as read, but I'll just walk you through it because it's worth spending some time on. So the background, obviously, to this is in 2017, we had the CQC attend to our hospital, and as a result of those inspections, we ended up with some Section 31s, which are sections for improvement and monitoring. And part of those sections meant that we were working through at pace in terms of improvement changes. Now, we are delighted that 2 of the Section 31s were lifted earlier in 2019-20, and then the last one was lifted in February of this year when we had a re-inspection back into ED. And although the overall rating of the organisation didn't change from good, our rating in our ED department changed from inadequate to required improvement. And that is a huge step for the organisation in terms of our improvement journey. So this will pick up some of the questions around ambulance handover and backing up at the trust, because it is multifactorial. It's not just the trust can't offload. It is the volume that we see coming through at peak times in terms of those ambulance arrivals. So on page 2 of the report, you will see the last section 31 was to do with triage of patients within a 15-minute window. And we have always, we've been one of the trusts actually in the Midlands and indeed in the country who's collected that data for improvement, and especially around the SBC chart you can see in front of you. So we have excelled in the improvement of making sure our patients are triaged. During COVID, we did experience a very difficult time in terms of ambulance turnaround and releasing them from the organisation. That was due to zoning, COVID status of patients, and trying to keep patients and staff segregated and safe. And the whole hospital, if we got a COVID positive patient on one ward, we had to rezone the whole ward, and moving 30 patients around took some time, and that manifested itself in the accumulation of ambulances at our front door. However, we have been on an improvement journey, and some of our medical teams led by Dr. Hobbs have been doing virtual wards and challenge wards, which has meant that we've been able to discharge patients earlier in their journey, and not only that, to get them seen and treated earlier in the journey also. So all accumulation of improvement methodology and projects that we were taking place through the trust meant that we improved massively in terms of our ambulance handovers. That's not to say we have the odd occasion where we still have 1 or 2 ambulances that go over that hour, but actually when you put that into context of the West Midlands and the Black Country, we are holding our own, and we have seen a huge improvement. Diane, myself and Eve, the chair, met with Anthony Marsh from the ambulance service, and although he was really pleased, we've still got work to do. We're not out the woods, and that's purely due to the volume of ambulances we see at the Dudley Group. So within the report, you will also see the visit that was from the CQC in February 21, what they saw and the improvements that they wanted to make, but it was a really positive visit that we saw through the trust. So you'll see the areas to improve, and one of those areas is within training for safeguarding, and I'm delighted to say that there's 100% of staff level 1 and 2 that have got the safeguard training. The signage was put in place immediately. It had actually been removed for cleaning, and that was replaced immediately whilst the CQC were there. And the next point is around working in partnership to make sure the back door of this hospital is open for discharge. So during COVID, again, there were no barriers. People were seen, assessed and exited the discharge from the organisation with 2 to 4 hours. Now, that's slipping back in some respects, so we're working together to see how we can continue to make sure our patients go to the next phase of care in their journey. So delighted to say that we have had the improved rating from the last visit in February, and we're expecting our unannounced visit over the next few months that we're preparing for. And that's not just for the CQC, that's preparing the improvement journey throughout the organisation. So I'm happy, as Dr. Hobbs will be, to take any questions or any points of clarity for what's in the report. I think you're on mute, Councillor.
Julian, did you want to add anything or wait for questions?
I think that's a tour de force from my colleague Karen. I think what I would say is we have the draft report from CQC, which we're checking for factual accuracy. I know this is being recorded, and I am breaking the rules a little bit. But what I read was there's some work to be done around flow, and that is improving all the time. But what made me very proud was to read that leaders were visible and effective within the department, and that staff felt very well supported by leaders across the trust. But I also read that the staff were able to identify and escalate patients according to national guidelines in a timely manner, and I felt very, very proud to read that. So I would make those 2 comments. There's a lot more work to be done, and we're not complacent. But actually, those 2 statements made me very, very proud of the staff indeed.
Thank you, Julian. I've got Councillor Jackie Cowell.
Thanks, Chair. I just wanted a little bit of clarification, really, on the last paragraph about improved rating. It refers to safe domain, and as a non-expert, I just wondered what that actually referred to, please.
Okay, got it. I'll start, and then Karen can correct me. So there are key lines of inquiry for CQC around, and their themes around hospital provider care, and one of them is care safe, and actually that is something we would want for all our loved ones. So what they during the 2017-18 inspection, they rated the trust as inadequate, which is a major concern. What they've done is they've lifted the 4 Section 31s, they've noted the improvement, and then when they've come in and tested whether care is safe or not, they've recognised that it is, it's not inadequate. So what they've done is they've moved us up to the next level, which is requires improvement. Now, my sense is that would be an underscore for the department, but actually we're very happy to see the improvement being recognised. It's a combination of the data returns, which we've been doing for a number of years now, and the inspection that they've made means that they have significantly more confidence in us.
Okay.
I hope it's helpful.
Yes, thank you.
You're on mute, Chair.
Sorry, I'm sorry, so sorry. Did you want to come in, Karen, because Julian said you were going to correct him?
Don't need to correct him, he's spot on. It's just that when we do have the inspections, the CQC categorise where we are. So all that is safe, we have well led, and we have another 2 domains. So around the safe domain, that's what they were primarily focusing on, as Julian's noted. So no, he's spot on. Thank you.
Lovely, thank you.
Thank you.
Any more members? Just one from me. It's on. It's paragraph 9. During the COVID, I presume during the height of the COVID pandemic, you ceased mandatory training. Now that was clearly was never going to continue with the COVID pandemic in place, and I would be aware that once you stop a training regime in its full entirety, it takes a long time to get back to the place where you were before. So it's good to see that you've got a clear plan in place. How long before you expect, given that we don't know really what the next 2, 3, 4, 6 months are going to do, how long before you can get back to a reasonable level of mandatory training?
So the mandatory training for the students and newcomers continued, because it's really important for the part of their education. But actually for the substantive staff who were needed clinically, that's when it stopped. So everyone has got a plan as part of their appraisal as well to complete mandatory training. So within the next 12 months, everybody should go back through that cycle that they are at. And actually, there's lots of other ways we've introduced new training into the trust with the digital platforms and technology that we have. So that there's lots of different ways to deliver that. The reporting of mandatory training is not only up to our quality and safety subcommittee at the board, but also to the board and through various forums through the organisation where this is monitored, both for nursing and medical teams.
Yeah, thank you. Right. And I suspect that there'll be fast access to some mandatory training if and when required as well.
Absolutely. Yeah, absolutely.
Lovely. Thank you very much. Any more questions from any councillors? No. Well, the recommendation is that the committee notes the improvement in relation to the quality and safety within the ED department since January 2018. It is also recommended that the committee note the improvement in rating from the CQC for the safe domain from inadequate to requires improvement within the department rating, and the rating remaining requires improvement. That really is impressive, given that you had a bit of a kick in during your inspection, and I think staff morale must have been at a really low ebb during that. So to recover it and to bring it back on an upward trajectory is all credit to everybody involved at Dudley Group NHS Foundation Trust. And thanks very much. Thank you.
Thank you. I'll pass that on. Thank you.
Can I pass the thanks of the staff on to the council? I know there was a comment from Matt Boucher earlier, but it is noted that the council have been extraordinarily supportive, not just with fine words, but with concrete actions, particularly during COVID. and we are really pleased to be working in partnership with you. If it's possible for that to be recorded in the minutes, we would be most grateful.
That's very kind of you, Julian, and we will thank you very much. I have to say, I mean, you say words, actions and words. I remember writing a letter to Diane and to Eve early on in the COVID pandemic, and I was nearly in tears writing it, to be quite honest, because I think what we've seen during the pandemic, we already had a good working relationship, but what's developed now is a breakable working relationship, and long may that continue.
Absolutely. Thank you.
Agenda item 10 then, diabetic eye screening procurement, Birmingham, Solihull and Black Country, pages 38 to 40. Karen, is this you?
This is me, yes, thank you, Chair. Good evening to you all. So I will take the report as read and just summarise if that's okay with you, and happy to take questions at the end. So diabetic eye screening, some of your members will know that people who live with diabetes are at risk of sight loss, and there is a national screening programme which we at Nhs England Public Health Section 7A services procure. There is a contract that ends in June 21, so therefore we need to procure a new service, and in doing so we've gone through our process in terms of seeking expressions of interest and seeking tenders from interested parties, and to note that our understanding of where we're at so far is that there is a likelihood that some of the ways in which or the places in which diabetic eye screening are currently delivered could change. That change could be even if we have the same provider rolling over, because of COVID, some small opticians are declining to carry on screening with COVID because of the infection prevention control measures that impact on them and their ability to see patients in a safe environment. So recognising that there is a possibility of change, we want to take into account the views of the people who use the service. So that's our sort of part of the premise for coming to you this evening, is that obviously because it's a Birmingham, Solihull, Black Country, West Birmingham service provision that we're re-procuring, it will impact on potentially residents of Dudley. We do have some information already from previous procurements in the South Staffs area, but recognising that the population of sort of Dudley, Birmingham, Black Country is different to that population, we want to get some local feedback on what priorities users of the service feel are the most important in terms of things like access, parking, travel routes, etc. And we also recognise that uptake of diabetic eye screening isn't 100%, and there may well be reasons why that is the case, and so therefore attracting an improved uptake is also part and parcel of delivering a service going forward. So just to say that we are working with Diabetes UK. We have had an opportunity to add some questions into an ongoing Diabetes UK service review that they're undertaking around the pandemic. We have developed some questions which we're checking in terms of language and suitability with some Health Watch colleagues from Walsall. But there is an opportunity for Dudley Health Overview Scrutiny Committee members to be involved in the feedback process if you would like to do so. So shall I stop there and give you a chance to ask questions?
Karen, thank you very much. Yes, Councillor Bayton first, then Jane Emery next.
Thanks, Chair. Yeah, I mean, I'd just like to know a little bit more about the model of community engagement that's been proposed, and the role that you think elected members can play in that, whether it be ward-based activity or whether it be on a wider scale. So I think a little bit more detail would be really helpful. Thank you, Chair.
Thank you.
So each of the HOSCs that we've been to so far have come up with a different way in which they want to be involved. So for instance, Wolverhampton HOSC members wanted a copy of the questions that they could take themselves to various groups that they were involved in. The Walsall HOSC delegated some of that responsibility to the Health Watch team for Walsall, and so they're helping us design some questions with their expertise that we will use through their routes for engagement. So we're trying to look for existing routes rather than reinventing the wheel. Diabetes UK, as I say, have got an ongoing pandemic questionnaire, and there's a QR code, you know, there's little black and white boxes which will take people who have got IT access to a questionnaire that they're already doing for a number of other aspects of diabetes care. So we've just managed to get a couple of questions onto that survey. The current provider, obviously, they do patient satisfaction surveys as well. So we have that as a sort of you know, ongoing theme, but really open to suggestions and ideas from yourselves in terms of how you would like us to engage with the Dudley residents particularly.
Thank you, Karen. Jane, do you want to come in now, please?
Yes, thank you, Chair. So part of the question I was going to ask Kathy is speaking to me about what kind of role around engagement have you already got in place. But yes, as a local health watch in Dudley, we'd be happy to support that. And obviously being part of Dudley Council for voluntary service, we can get that out to communities as well. So if you want to get in contact with us, then we'd be happy to support it locally.
That's lovely. If somebody could give me your email address, then I'll pick that up on offline.
Well, are there any more questions from members? No. If I can make a suggestion, because Jane is from Health Watch and has connections with DCVS as well, Jane's involvement in those two organisations is going to be paramount to getting out to the people that you will want to know details from. So I would suggest that Jane would be our link, because she's on our committee always, and then Jane could come back and report to us and we could report back to you. That's a different mechanism, but actually it's probably a more efficient mechanism, because rather than councillors who have no experience of diabetes, Jane is likely to have contacts with diabetes and using your service.
That's absolutely great.
Would that suit you, Jane?
Yeah, that's absolutely fine, and we can look to see what engagement activities, and if needs be, we can always pull together one of our people's networks specifically around this if we felt that was valuable. So yeah, happy for you to get in contact, and we'll be supporting. We can feed back to the committee as well.
That'd be lovely. Thank you.
I've got a couple more councillors. I've sparred something off here. Councillor Jackie Cowell.
Yeah, thanks, Chair. I've just had a thought. They may already be consulted, but I think there's already an existing network, isn't there, of patient participation groups based around surgeries, and I guess patients, you know, it might be something they could look at from their own, because they'll be looking at their own area, won't they? So they probably have a good idea about the needs of what was in their own, sort of based around their surgery and their particular patient patch. So if they're not already included, I thought that might be an idea.
Okay, Jackie, thank you. Peter Miller.
Yeah, I think one of the other things important is that when people if they've got diabetes, is to encourage them to have these tests. They are very important. And I think the other thing we need is to make sure that the opticians are as near as what they can be to people's homes, because once you've had it, you can't drive. So if you haven't got another driver in the family, you've got to get there and back, or more back. So I think we need more opticians taking part as well.
Okay, thanks, Peter. I think thank you, Karen. I think the two recommendations are that we note the update provided in the report, and the wording of the second recommendation is quite pertinent. It says, confirm whether members wish to be directly involved with the patient engagement exercise.
And I think if we do this through our own officers on the council and Health Watch and DCVS, I think you'll get a better result from the public rather than people sitting in it. And the report can come via us to yourselves. And I think to be quite honest, you'll get a far better report from Dudley than probably anywhere else in the West Midlands.
I look forward to that, Chairman. So I'll catch up with Jane Emery offline and discuss a way forward. That'd be very helpful. Thank you.
Okay.
I think the word directly was more as a HOSC as opposed to personally, individually.
Yeah. Well,
okay, but that's lovely.
Anyway, but Karen, you want to come in?
Yeah. Apologies, Chair. I think just a quick point. I think there's some fantastic lessons that have been learned through the vaccination programme in terms of addressing inequalities and reaching out to communities. And I think those could be built in and also help you with this programme. And I'd certainly like to see that we are monitoring the uptake of the programme against inequalities priorities, because I think it's really important that we're reaching all of those who can benefit. Thank you.
Absolutely.
Thank you.
Yeah, I think I would say the first stage is to procure the service, and the second one is then to address the inequalities. But we'll use the feedback from the patients to do both.
We will have gained a lot of health intelligence during the last 12 months regarding people's health and well-being. And I think if we do it through that route, if members agree, we do it through the Health Watch, DCVS, report back to this committee, in conjunction with our officers, report back to this committee, and then report back to you, Karen, if you come at some future meeting to this committee.
Okay, that's grand. Thank you.
Okay? Do members agree
Lovely.
with that?
Yep.
Yes, yeah.
Sounds a very sensible way.
Yeah.
Thanks very much. I think it's not a roundabout way of doing it. I think it's a more robust way of getting the true picture of what it's like out there.
Okay,
because,
thank you.
72 councillors isn't the community. We just sit on these meetings. The community tells us what's right and what's wrong. Thanks very much.
Okay.
Thank you, Karen. Thank you.
Thank you. Bye-bye.
Bye. Agenda item 11, dissolution of the Section 75 Mental Health Agreement between Dudley and Walsall Mental Health Trust and Dudley MBC, pages 41 to 46. Who's this one? Santok?
Stephen. Chair, it's Stephen.
Hello,
Stephen.
Okay, Stephen, thank you.
Hello, Chair. Hello, colleagues and councillors. I'd just like to begin by thanking formally the Director, Matt Bowsher, for all his support during the dissolution of the Section 75 agreement. And I'd like to take you through the paper, if that's okay. I begin with a brief background to why the dissolution happened. We know that Dudley and Walsall Mental Health Trust had a legal agreement with Dudley MBC, and they provided services to deliver our mental health services. With the merger of the borough, 5 boroughs across the West Midlands, that entity, that legal entity, ceased to exist. So it was an opportunity for us to bring mental health social workers back into the local authority. And what we've done is a very successful transition of that. Whilst in situ, there were 53 social workers, residential workers, admin workers, senior social workers, AMPs, all delivering services within a clinical setting. Now, as from the 4th of January, those social workers are back within our directorate. And I have to say, Chair, the relationships between the local authority and health are, I believe, very strong. And the focus of this transition was around the safety of the individual patients. So the management of the process was very, very robust. We had a number of meetings, 38 meetings were held. These included one-to-ones, group supervisions, task and finish groups. All of those meetings were designed for the smooth transition of the service users back to the local authority. And what was very key is there was an acknowledgement that the service users who were subject to the provisions of the Section 75 agreement had developed relationships with the professionals who were delivering their care. We took this into consideration and we made sure that there was a caseload management tool that was designed. That caseload management tool really highlighted the most appropriate professional to deliver that person's care. But what that meant is some of those relationships that were formed would actually be lost. So we wrote out to all the service users, we wrote out to all the professionals, we had numerous consultations, and that ended with approximately 75% of the caseloads of social workers remaining within a health setting. What that has meant for our social workers is that social care staff now are able to deliver that social strengths-based practice. They're no longer within a clinical setting. They're no longer being the lead professional for people who are on second-line medication. That brings them very clearly into the roles and remits of their professional practice. They've been able to engage in appropriate training. They've successfully completed all their liquid logic training. They've benefited from Care Act training, and the staff feedback has been incredibly positive. As I have to say, the relationships with health have been incredibly positive as well. What we've done to maintain them, Chair, is we have monthly meetings with managers at a very senior level. We discuss any difficulties that we're facing, we agree pathways, and we agree panels that can help us with any issues that are arising. There's a clear vision now for social care in terms of mental health within Dudley, and that's that we're going to take a whole life approach. So we're going to take a life course approach to ensure that the declared requirements of the Care Act 2014 are fully delivered. We're going to think about strengths-based practice. We're going to ensure that our offer promotes autonomy. We've got a preventative strategy. We can develop outreach services, and that's going to be incredibly important after the pandemic. We know that people are at risk of loneliness and isolation, and that risk may increase after the pandemic. We're very clearly going to use that strengths-based practice to make sure that we connect people to communities. And in connecting people to communities, Chair, we're going to promote their recovery. We will absolutely adhere and meet, and where possible exceed our duties under the legislative frameworks. They are the Mental Health Act 2007 and the reforms of the Mental Health Act 2007, which very clearly now say that any intervention has got to have therapeutic value. That's a real change from the previous act. We're going to be absolutely clear about Mental Capacity Act 2005, including the deprivation of liberty safeguards. And within the new structure, we've built in a provision to meet the requirements of DOLS, and also when it comes into fruition, the new liberty protection safeguards, which will be coming in approximately in April 2022. And as I said, we will be in a position where we can offer and deliver the assessments required under the Care Act 2014. In order to maintain a timely and robust response in terms of the Mental Health Act assessments, and particularly within a clinical setting, the AMP hub will remain in situ at Bushyfield Hospital. This means that we'll be able to maintain those excellent professional relationships, we'll be able to offer advice, we'll be able to give a really robust student experience and professional experience to newly qualified AMPs and students, social workers who are training to be AMPs. That's already, we're seeing real benefits from that. As I said earlier, there will be 2 full-time BIAs in the new structure, and they will deliver our interventions in terms of the goals, and then the transition period into liberty protection safeguards. The introduction of social workers will enable us to really strengthen our community offer, to build on strengths-based practice, to develop that asset-based community work, to begin to deliver a social media platform, and work's happening on that, Chair. I think in our last meeting you asked for the link for the Facebook. That's been sent to all parties now, and as I understand it, there's been 5,000 people who have accessed that service, and we are developing a directory of services as well that can really connect one area of the borough to another area of the borough, and really inform people about how and what assets they can hope to expect and to engage with. There have been challenges within the Section 75 agreements and the subsequent dissolution. Part of those challenges have been around funding placement panels. There was an aftermath of social workers are no longer reviewing health placements, which is appropriate because reviewing health placements in a social work role is not within the professional practice. So there's been some negotiations, some discussion. I had a meeting today and we've agreed to set a panel up around how we deal with any contentious issues. And that's been really useful and informative. Like I said, the relationships within health remain very positive. And there's an acknowledgement that actually people have to work within the professional roles and responsibilities. We've learned a great deal from this process, Chair. We've learned that effective communication is absolutely key when you're doing a change management in this way. We've learned that our staff need support around that cultural change, and we've put that cultural change support in. We've learned that staff needed to be able to access appropriate training, and that too has been put in to support our colleagues. The feedback, as I said, Chair, is very positive from the staff and the local authority. And to this date, which I am very proud of, we have not received one formal complaint around the dissolution of the Section 75 from either directorate, either health or social care. And I think that's a testament to the way that this has been communicated. In terms of financial savings, Chair, 400,000 has been approved as part of the medium-term financial strategy. Of this, 140 came from the dissolution, Section 75 of the management recharges, and the remaining came from the planned, will come from the planned restructure. As I said, we're working within legal frameworks of the Mental Health Act 2007, Mental Capacity Act 2005, Deprivation of Liberty Safeguards, and the Care Act. Also within that, Chair, we're very clear about the Human Rights Act. There is no, at this point, the services will adhere to both best practice and statutory requirements under the Equality Act. And HR have been heavily involved in the process, and to this, at this juncture, Chair, there have been no difficulties arising from that. The proposed model will seek to ensure that individuals who experience mental health difficulties and illness will be able to access appropriate support across the life course, from a preventative strategy to a support strategy to a recovery strategy. We really want to embed the ethos of strengths-based practice and community cohesion into everything we're doing. Chair, I'd like to take any questions now, if I may. Sorry, Chair.
Listen, I'll get there eventually. Just wait. Any members wish to ask any questions, Stephen? Councillor Baden, Kathy.
Thanks, Chair, and thanks, Stephen, for the report. I think I'm possibly the only person in the virtual room today that has seen this go a full circle. because I worked for the authority and was involved from a trade union perspective when they went across to the Health Trust. So it's quite an interesting transition for me. I'd like to just pick up on the report. So page 43, item 9, where you talk about vision and opportunities. And you talk about the work that Woodside Day Centre have led and the change in model of delivery of support there. And I just wanted to understand from you the service users' participation in that change of model, because I know when I'd done a number of cabinet visits and shadow cabinet visits to them, service users were very, very, they had a really strong identity with Woodside, but with the physical building as well as the services being offered. So that's one question. If I just run through the other couple, and then I'll, if you can come back to me on them. So item 16 on page 44, when you refer to challenges, I think it'd be really helpful for us going forward, because obviously this will come back in front of scrutiny again, that we should have some case studies so that we can understand how the service has improved pathways and outcomes for service users. On page 45, commercial and procurement, when you hope that the cost of care packages, for example, 50-50 splits may be secured. How do we have an idea of how many cases we think that will be secured in, and how successful we will be in doing that? I know any conversations around budgets and purse strings are always incredibly difficult ones. So what's your anticipation in terms of success for the authority in that? And just finally, what will be your measures of success? You've talked about complaints, that there have been no complaints received, and obviously that is one indicator of certainly the smoothness of transition. But going forward, and when this comes back to scrutiny probably in the next municipal year or after that, what will be our measures of success that we'll be able to have a look at and understand for service delivery? Thanks, Chair.
Thanks, Councillor Burton. Can I take your first question first, if that's all right?
Yes,
of course it is. Carry on. Yeah.
So, Councillor, can you just repeat the first part of the question, please?
Yeah, it was really in terms of Woodside and service user participation in the change of model that was used there.
So what I asked the staff to do, Councillor Burton, and elected members, is to develop a new vision. And the new vision they developed is a vision called Infusion. In developing that vision, there was consultation with service users, and all service users who attend Woodside were asked to consider how and what they see the future of Woodside being. And we need to be clear about Woodside. It is a fantastic service, but it's a service that has only given service to a small number of people. When I did some work, there was 152 people attending the day service. Out of the 152 people attending the day service, a number of those were repeat attenders. So what we were seeing is an excellent service that we're delivering, really effective support mechanisms, but the support mechanisms were to a very small body of people. What I want to see, and what the consultation has showed, is that people have got more appropriate access to services in the community, and we develop that outreach. That's where we can start to engage with more of the hard to reach groups, the hidden parts of society, people who may not know that Woodside is available, people who actually couldn't access services because they weren't in secondary mental health services. And part of the development is around, if we're going to really be inclusive, and we know that COVID has highlighted the major increase in mental health episodes, and particularly for people who've never had a mental health illness, then the only way that we can do that is to have and build an outreach service that can really connect and reach to those people. So there was and there will be ongoing consultation. We are working with our business change managers now to look at consultation. You're absolutely right. Consultation with the members of the public is key, vital, necessary, and required. And it's a piece of work that is really at the forefront of everything we're doing. But I think what's driving this is the fact that we know we've got an increase, the fact that we know that the current provision only allowed people who are under secondary mental health care to access it. What we want to do is really widen that up to the whole public who require that support. Does that answer your first question, Councillor?
Yeah, I think it does. I think where I was trying to get to, not only with the consultation bit, is also the ongoing, the vision, the developing vision. Yeah. So that's great. Thanks, Stephen.
Okay. Sorry, can I take your second part of your question?
Yeah, really, it wasn't really a question. It was more, can we have really at the next time we have scrutiny? So I think some case studies would be really useful so that we can understand how the changed service has really improved pathways and outcomes for people. And it might also be useful to understand it from a delivery perspective about how working under the new style has actually aided a better quality of working experience in order to deliver a better service. So I think that perhaps going forward, that'd be really helpful.
Okay, yeah, thanks, Councillor Bateman. I completely agree with that. Unfortunately, at this juncture, because we're still in a very close proximity to the change, I couldn't really provide that, but I will give assurances to the electorate that those will be available and readily available within the next 6 months. And already we're seeing some real opportunities. We're seeing people who are starting to engage in employment. We're seeing people who are starting to engage in training. We're seeing actually people who are service users starting to work in the vision of infusion. So we are doing that connectivity work. We're also working with Arts for Change, which is a charitable organisation that's going to be working very closely with Infusion to deliver the vision and make the changes. So that will absolutely be available. And in terms of the issue around funding and how the vision might change, and at this juncture, I can't give you any definite figures. I can give you some very early indications that because we've got a separation and we've got a clear understanding of roles, then people are taking the responsibility for funding in a slightly different way. And the relationships that we've got with our health colleagues are enabling us to challenge appropriately, agree where appropriate, but come up and use shared tools to decide and to develop funding strategies. And part of that shared tool is the caseload management tool, which clearly identifies who should be a lead professional. And we're already seeing some real positive changes in the way that panels are being attended, with the fact now that we've got social workers attending panels. We've also got CPNs attending panels. What that's doing is it's allowing the chair and the members of the panels to make informed decisions from that multi-agency basis. Before we weren't having representations from CPNs. They were just predominantly from social workers who were holding health cases. Well, that has very clearly changed now, and the dynamics and the outcomes have changed to reflect that process.
Thanks. And just the very final part of it was measures of success.
Yeah. So as I said to you, Councillor Baden, when I did some research around the use of Woodside, what I found is that actually it was quite an exclusive service because people could only access it if they were under secondary mental health care. One of the indicators for me will be, have we got increased numbers of people using the service? And I would suggest that that's the best indicator. And I would also suggest that we will hit that target. If I'm quite honest, I'd like to see us up into at least the high hundreds to 1,000 range of people being able to be signposted, worked with, recovered. Part of the goal of our service will be to signpost to community services. It will not be to deliver interventions from a statutory organisation. It will be absolutely to connect people to their communities to seek that support. So we will be doing some work around the numbers of people accessing services, but I would hope it would dramatically increase, and I would also see another outcome of people's narratives. I mean, what I want to do as we're on this journey is collect people's narratives, and as you said, have case studies, have service users give presentations to the elected members as expert by experience, really listen to what their experience has been in their journey. Think about the use of the social media. Already we've got over 5,000 hits on the Facebook, as I was told that yesterday. That's gone from its inception to 5,000 hits within 6 months, which I think speaks for itself. We've also working with staff around radio presentation and information who can deliver support to the wider community, and really thinking about how we have supported people from a social care strengths-based position to access every opportunity they can, training, employment, social, and really understand their narratives. So I think we'd probably be able to do some qualitative and quantitative research around that and deliver the outcomes to the elected members in due course.
Thanks, Stephen, for that answer. That's really helpful. I look forward to it next year.
Chair, you're on mute again.
Thanks, Chair. You may spot a slight change of office in the intervening period. So just several quick points here. We're not at agenda setting for the new municipal year for scrutiny as yet. Doubtless there will be some members of this committee that are hopefully on the committee next time around. I think there's two areas that have come out of the debate so far. The first is that I think it would be great to give you the opportunity to have a look at that model for future day opportunities for mental health and the model that Stephen's describing. And secondly, you may well want to consider what constitutes an effective community mental health service in a broader sense in terms of data that comes to committee. Second point is it's very difficult to affect positive management of change at any time if it's one organisation to another. To do it as seamlessly as Stephen's led during a pandemic is altogether another dimension of complexity. So credit not just to Stephen but to all of the staff who've moved with him for the very calm, professional and well-planned way in which this has rolled out. And thirdly and finally, we need to really thank all staff involved in mental health, both in the acute and the community sector. Some of our officers in the mental health service have been at the point of greatest risk. They're going out, they're dealing with people in a crisis, they're dealing with people quite often who are COVID positive. who obviously need urgent support in the most difficult of circumstances, and they've done that and done it incredibly selflessly and diligently. And I think the whole pathways worked very effectively through the pandemic. I did say it was my last point. I missed one little bit. In terms of Woodside itself, when we're going into that new model, I fully understand both the community and the people who've used the services commitment to that building. The committee does need to be mindful of the fact that Woodside is a very elderly site. It's a site that needs a lot of investment in it on major things like the roof, the heating system. It's a very old Victorian-based building, and given that we know we're going to have significantly higher numbers of people in need of mental health support going forwards, we do need to think about a model that reaches into the community, not just a building-based solution. But my suggestion is we get into that detail in more time in the new municipal year, Chair. Thank you.
Thank you, Matt, and all the points are noted on that. I think good points raised. And Stephen, thank you and all of your staff for the challenge that you've undertaken. It came at completely the wrong time. I appreciate that. Just when we're talking about community mental health service and support in the community, you know I'm the chair of Dudley Mind, and I'll just read out some of the groups that we run in our community as a charity, with a staff of 2 permanent staff. One's in the office and another one's a peer support officer, and the other 3, including the chief exec, is part-time. I'll just run through some of these, and these are the sort of things that we do on a shoestring, which are already there for people who've not accessed statutory mental health services or have accessed them in the past, but they've come out the other end. So we have 2 anxiety and depression groups, a bipolar disorder group, a deaf talk mental health group, LGBTQ plus group, parents of anxious children group, carers support group, loneliness support group, BAME support group, a poetry group, a horticultural project, Jolly Joggers, and that's based in Wolverhampton, but we'd love to start one in Mary Stevens as and when time permits. And then it goes on and on and on. So the third sector, the voluntary sector, supports mental health in a massive, massive way and keeps people away from the statutory services as much as we can. And that comes back full circle to the support for voluntary sector from this local authority. It's a win-win situation for everybody if we can all work together. So thanks for your report, Stephen. The recommendations, anybody else want to add anything to that? No? So the recommendation is that Scrutiny notes the contents of the report to review the transition process, the current position and the vision. So it'll come back to us again next year and probably the year after. Thanks, Stephen. Thanks very much.
Thanks, Chair.
Thank you.
Thanks, councillors.
Thank you. Moving on to agenda item 12, successor programme, pages 47 to 56. Marie.
Good evening, Chair. Good evening, everybody. Myself and David are going to take you through the progress and the development of the replacement of the social care system as part of the delivery programme of our successor programme in adult social care. We've provided a full report, so we're just going to go through a brief presentation with some of the headlines and then obviously take questions and points of clarity.
Marie, is it sharing now?
Yes.
Yes.
Brilliant.
So with regard to phase 1, we implemented the new social care system despite the pandemic in September of 2020. Children's went live with the replacement system in November of last year. In terms of phase 1, that was around transitioning from one legacy system, so Swift and AIS. It was becoming obsolete and not fit for purpose. Moving to a new social care case management system called Liquid Logic, and it's also supported by a new finance system called Controc, and that system has gone across both children and adults. The new systems provide a mechanism around consistency of practice, processes, and through those consistencies, we're looking to greatly improve the outcomes for vulnerable adults, children and families. The system, so in terms of phase one, it was always around ensuring we've got the same functionality, better functionality. But as we move into phase two, what the system does is provide a number of modules that enhance and create opportunities, opportunities to transform services, opportunities to interact with the public in very different ways, and therefore we can start to look at potential efficiencies in the future. Just in terms of assurance, this is our governance structure. So with regard to adults, Matt takes back to the Strategic Exec Board on a quarterly basis the updates from the Successor programme. What the Adults Project Board does on a monthly basis that we meet, and through sort of the decisions, the risks, the issues, those are all fed back through Adult Social Care Leadership team on a 6-weekly basis, giving Matt and SCB full oversight of everything that's happening. As I said, the system is over children's and adults, so children's will be reporting back to their scrutiny committee, but we've built in an assurance group, so where there's interdependencies, where there's mutual risks and issues, there may be shared resources, say around ICT. That assurance group has ongoing communication, so we can highlight any difficulties, any issues, any barriers to make, you know, that more of a smooth running implementation from phase one now into phase two, and we take that back through our other governance structure back to our directress in terms of solutions to move things forward. David will now take us through phase two and the progress.
Okay, so my name's David Winter. I'm the Adults Successor Project Manager on phase two, and I was also the project manager for the latter part of phase one. So basically, so for phase two, as Marie was saying, phase two is about transformation. The initial work on phase one was about transition. We needed to move to a new social care system from the legacy AIS Swift system. So what phase two will actually bring about is effectively improved benefits to actually help the citizens of Dudley. It will help providers. It will give improved relationships with the likes of the public, third parties and providers. It will improve the data security, information security, legislative compliance, and of course the all-important data quality. So this sharing of information will actually help with the workflow. It will help with information flow, and it will provide a new level of system capability. What I want to take you on the next slide, which I'm just going to move on to now, is effectively just the scale of the work that we're actually doing here, because there's a mammoth amount of tasks on here. And what I just want to do is summarize these tasks for you. So basically, what we're going to do is one of the big opportunities here for development is about the online portals. This will provide a new medium of which to engage with the public, providers and the third parties, and it will provide a far, far better integrated approach. So I've just listed here a number of things that these the portals and modules will actually give us, and just give you some examples. So the citizen and client portal will give you an ability to signpost the public user or indeed carer and quickly understand you know, if there's any assistance available, if it'll give you potential for self-assessment. If there is any abuse, you can report a safeguarding incident which needs to be reported or resolved. We also actually will get from things like the delegation portal an efficient solution for the likes of the police, doctors, nurses to complete parts of the forms that are available in our social care system. And what's really, really clever about that is that it does not need that third party to have access to the Liquid Logic system. They also need to have is the internet. We'll also be able to actually gain third party access via something called single view, and that will give access to certain parts of the data within our Liquid Logic system to those third parties such as doctors, nurses. We're also looking to be able to share information with our automatic document transfer system, and that's from the hospital to Dudley's social care system. Via the provider portal, we'll actually be able to give providers online interaction and enabling things like, you know, purchase orders and actuals to come back into Dudley's system. It will provide social workers a new means via the mobile applications. This is the Liquid Logic mobile application, so that people are able to use their devices such as iPads, iPhones or Android phones with the actual public directly. So they'll be able to, when they go and meet people face to face, they will actually be able to interact with our tool systems back at the headquarters. All in all, though, and the key thing about all of this, though, is what it will do is it will bring Dudley right up to scratch with best practice across the country and make us along the lines of the best councils in the country. And that ultimately is Matt Bausch's vision, and that's the vision that we're actually going to bring and make true. So I'd like to take the opportunity for any questions or answers.
Right, thank you very much both. Any questions from any members? No? Oh yes, Councillor Jackie Cowell.
Yeah, thanks, Chair. It was just a reference really to paragraph 14 on page 49. It refers to 5 major incidents since the system went live. I just wondered what that referred to, please.
I'll answer that, Marie. Okay. So basically these incidents are incidents that happened with the ICT infrastructure. So it was to do with the servers performance, and basically we've actually remedied that with Liquid Logic, so it's all been resolved now. But it's nothing to do with either the Liquid Logic application or the Controc application. It's to do with the stability of the infrastructure. But now we've actually been doing this now for 7 months. The infrastructure is far more stable.
Thanks, David. Supplementary, Jackie.
Thank you.
Now, Kathy Baton next, please.
Thank you.
Thanks, Chair. I've got a couple of questions. Do you want me to give you them all to start with, and then you can come back on them at the end? Yeah. Okay. So page 48 on the report, number 6. What due diligence was done at the start to evaluate the risk of the system becoming unsupported during its anticipated life? And we know that various systems become out of date, don't they, and incompatible with developments in technology. So what due diligence has been done around that? Number 11, has user feedback from the training been collected, and has that then identified or informed further training needs and training models? Page 49, number 13. What's been the turnaround time for queries, and has that impacted at all upon service provision? So those are my questions. Thank you, Chair.
Thank you.
In terms of the due diligence, we went through the full procurement process, Councillor, which included due diligence in terms of, like you say, technology moves on. Liquid Logic is one of the market leaders, and in terms of their ongoing development plan, that's supported in terms of the tendering process why Liquid Logic was chosen. We also undertook engagement events with staff who use the systems, obviously, in terms of the providers that were shortlisted in terms of the new adult social care systems, around usability, fit for purpose, what was required by Dudley. And we also got feedback from other local authorities that had worked in partnership with Liquid Logic, and that all aided the procurement process, which in part as well covers due diligence. In terms of anything more technical than that, I'm sorry, I can't answer it, but I can find out. In terms of training and developing training to respond to people who use the service, we've got a very structured change management process. So the system was implemented, so we did all the engagement with the workforce in terms of phase 1. And then when staff started using the system, there was obviously some tweaks that were required or things that had been overlooked. And what that followed through into was then a revised sort of training. So what we did in terms of training, we've developed e-learning with a provider called Me Learning, who had got experience of working with lots of local authorities around Liquid Logic. So we commissioned Me Learning to work with us. They also provided face-to-face training via virtual training, but virtual classroom, should I say. So we've definitely tweaked the processes. There has been some developments, there has been some changes, and what we've ensured is that training with Me Learning, our L&D service has made sure that those staff are trained and are knowledgeable in terms of using the service. Also, what we did in terms of implementation and what's still there now is that we trained champions within all of the teams. So there was an expert by experience within those teams, so staff could go to that champion if they'd got a query. Picking up on your point about how quickly did we resolve things, so we raised jobs through ICT when we found that it wasn't sort of a practice issue, if there was any sort of technical issues. And what that went into was the programme team looked at all those issues with ICT to actually make that resolution much quicker. In terms of timescales of how quickly things were resolved, I haven't got that data at hand, but what we do have on a monthly basis through our steering group is that ICT report on all the jobs that come through ICT. We identify if there's any themes, any issues that we need to pick up on in order to make that as seamless as possible.
Can I just add to your points, Murray?
Yeah.
So for the question 2 question about training, so as part of the quality of learning that Me Learning provided, we actually carried out a survey to find out what the score was from the participants. Each time they actually carried out a training module, virtual classroom training, and this score was actually over 90% overall across adult social care. And also then on question 3 around the turnaround on queries. So in the first 3 months, we actually had over 1,000 queries that were actually taken by MyICT, that's the system which Dudley uses to capture queries for anything to do with the tools and systems. And with the project team, we were able to actually go through that. So we regularly updated Matt and the programme board on progress on how we were achieving against these questions, and we were always hitting 90% each time we went to the programme board. So I can't remember the exact numbers, but it was always very, very good. And I was very impressed on how the ICT and the project team reacted to all of the questions that were asked by the individual stakeholders.
Thank you both. Matt, you're going to come in now because it's normally to clarify a point.
It is, thanks, Chair. So just in relation to Councillor Baton's query about how can we be assured that Liquid Logic will be around and therefore it's a sustainable platform. Now AIS and SWIFT has ceased, Liquid Logic have a much greater market share and are picking up contracts all over the country at the moment. Allied to which we've got contracts in place that guarantee a level of service for lengthy periods of time. So both the due diligence in terms of procurement, the changes in the marketplace, and the fact that we've got formal contracts governing the work we do, the systems, the operability, the performance, etc., gives us that assurance. And there's no way we would have put the time, money and effort in to shift to a system that was likely to disappear overnight. The other quick points I wanted to make was that we are committed, particularly now we're in the transformation stage, to make sure that what we've got here is a tool that works for local people. And Marie and David have been doing some work with Jane and her colleagues at Dudley Health Watch to make sure that a whole range of different folk with different needs are getting to express what they want to see, and get a sense early doors of how the system's going to work for them. So we'll end up with something that's fit for Dudley purpose, not just fit for any purpose. Next up, I've got to say the same thing that I said in terms of the mental health service. Management of change is tricky in normal times. Delivering a new system in the midst of a pandemic when everybody's scattered in their own homes has been an inordinately difficult thing to achieve. And credit goes to all of the folk involved in Successor, all the staff that had to get used to a new system in the midst of a global pandemic. And I want to particularly single out Marie, Joe Vaughan and David for their roles in leading, in Joe's case, phase 1, Marie's case, phase 2. And David, quite rightly, has retained his role on the basis of the results he achieved in the first phase for the council. Members, and a number of members indeed on this committee, going back 2 years, were raising very sensible questions about the amount of time it was taking, whether there was sufficient grip or not, whether the budget governance was working, whether we were going to get a solution that worked for our staff. What we've tried to show you in these slides is that there's a real rigour here now about how this operates in terms of governance, risk management, pace and value for money. And I think this has done a full 360 from a poor start to being something that we can look at now in terms of management of change across the rest of the council to make sure that we get it right going forwards. That's it from me. Thank you, Chair.
Thanks, Matt. Is that okay, Kathy?
Yeah, thanks, everyone. I think it was just really around the due diligence bit of ensuring that we know that technology moves on and that equipment, capacity changes, and to make sure that our system will grow with any changes in the future so that technology doesn't outsmart it and it becomes obsolete, I think is where I was going with that. But thanks for the response.
Thanks, Kathy. Elaine, Councillor Elaine Taylor, or Eileen Taylor, as you're now known.
Come on, Eileen, now. Come on, Dave. Right, yes, Dave. Matt has just addressed some of what I was going to bring up. Back in the day, Liquid Logic, I was part of the that group that Matt was talking about, having concerns where we were changing over to this Liquid Logic. My question now is, if I'm understanding this right, is fully a fully joined up service? Does all of our children's different departments, is it an all joined up service? because that was what one of the main issues that we had why we brought this in the first place. The time it's taken is unreal, really, and the cost of it is unreal, really. But if it is going to be proved that it's value for money ongoing, then we can understand that. But will you just answer me that one question? Is this now a fully joined up service?
Thank you, Elaine.
Councillor, do you mean is it a fully joined up service across children and adults?
Well, I would like to think that it was fully joined up across children's, but I would love it to be joined up all together across adults as well. But I don't suppose that's the case.
In terms of LIS, it's a fully joined up system across the whole of adult social care. Obviously, adults, we've not, the children's system is LCS because that's about sort of a need to access children's information, and we wouldn't want to give that access across adult social care. But in terms of the fully joined up, yes, it is a fully joined up because what happens in the LIS system, so from a social worker assessing, putting the information on the system, out the back end of that feeds into our financial system. So it's not a separate system, it's all interlinked.
And that was what it was. That was the main issue that it was being set up for. And I understand where not anybody should be able to access things, especially with our children. That's a given. But as long as the systems are there, where one call and it's dealt with, which is what we wanted. Yeah. Thank you. Thank you.
Thank you. Thank you, Eileen. So no other. Oh, hang on. Councillor Baton again.
Sorry, Chair, I've just got one very, very quick other question, because I mean, I know it's talked about partners being able to input onto it or to put information into the system. And I just wondered, so for example, our housing colleagues are very often the first line of contact for many of our residents, and they may actually be the ones to raise some very early initial concerns. Will for example, housing colleagues within the council be able to input information onto that and to flag up a concern about a resident?
That's where David said, the list of all the portals that are described. One of those areas is for professionals to input and share that information. So it will then go on the front end in terms of through that interface of that portal, but it will feed into the back end of the adult social care system. So yes.
That's reassuring. Thank you.
Thank you. No more hands up, so I'm going to come to the recommendations. Thanks very much for the presentation, Marie and David. Recommended that the committee note the contents of this report and provide the directors with the support required to successfully deliver the organisational process and systems change. Is that agreed?
Yes, Chair.
Yes, yeah. Lovely, thanks. Well, you won't believe this, but we're within about 10 minutes of our intended timeline, so how we've got there, I have no idea.
Chair, I'm not sure
Yes,
if you've
Ellen.
seen the note from Matt Bowsher in the chat, just to say if anybody does want a demonstration of the system, to drop David a line and they can arrange that for them.
Yes, fine. Thank you very much. You've said it instead of me saying it then. Thank you.
Thank you, Chair. Thank you, everybody.
Thank you, everybody. Thank you.
Transforming Care Programme update and risk pages 57 to 65. Is it you, Matt?
That's myself, Chair Santok.
Okay.
Good evening, everybody. I'm going to take it as read, Chair, if that's okay with you. The report has been read, and I'm just going to summarise the key points of the report and then hopefully have some time for questions at the end of that.
Thank you.
As we're all aware, the Transforming Care Programme, so in the Black Country programme, began in 2016 for an initial 3-year period, but that's now extended and it's ongoing. There doesn't seem to be an end to it at the moment, so which is a good thing in a lot of ways. It's now part of the NHS long-term plan as well. The key focus of the Transforming Care agenda really is to avoid hospital admissions at all costs, except for those that really require it, and actually make sure we're supporting people closer to their home environment, closer to their families within the localities. And to that end, we're doing very well, actually. If you look at the item 9, you've got the local data there for Q4. We only had 7 adults, 3 were in specialist commissioning beds, and 4 were in CCG beds, commissioned beds. And actually, we had no children or young people in specialist accommodation, hospital admissions in any shape or form. So that's a really good, positive story there in Q4. In terms of hospital avoidance, we've got several work streams that are active across the Black Country, and we were given by the Secretary of State a community discharge grant of about 657, which was to enable local authorities to enhance their social care preventative offer. And so I'm just going to go through the various work streams, if that's okay with you, Chair, in terms of what the aim is of those individual and what we're trying to achieve with them individual work streams. The first one was the step up and step down facilities. What the local authorities recognised was that actually from a social care perspective, we don't really have a joined up offer that enables respite, that enables our hospital avoidance to take place. It's either we're putting support into an already stressful environment with our health colleagues, or we're then actually taking people out and they end up in hospital, which wasn't quite right. So we're undertaking a pilot project this year, which we're hoping to go live in autumn, where it will be a step up, step down facility for our clients, and it takes people away from their stressful environment. So that's a really big step, and it's it will be commissioned across the 4 local authorities. So real joined up work going on there across the 4 the local authorities. The second piece is the short supports program, short support bids program. I have trouble saying that every single time. And that's aimed at enabling much smaller providers to come into the market, possibly look after 2 or 3 people rather than having huge, gigantic units looking after 30, 40 people. And again, we've got a pilot in the pipeline working with one of our local residents who's actually done that herself and delivered some really good results for her son. So we're going to take the learning from that and build that into the programme. Empowering You was an emergency support service commissioned by health colleagues to really support people from going into hospital and actually supporting them at home. That's now coming to an end, as the report indicates, and the local authorities have been tasked with establishing an alternative from a social care point of view. And in Dudley, we were already working with an agency called Complesso. We're now expanding that in terms of enabling them and us to develop an emergency response unit or response as an alternative to Empowering You. So again, that work is in the pipeline, and we'll get some results towards the end of the summer in terms of how good that's been and whether we make that long term. There's also recognition across the Black Country local authorities that the market itself really needs to be stimulated to make it attractive for more specialist providers to come in, because one of the things that has happened as a result of the Transforming Care programme, we're now seeing more acutely unwell people being managed in the community, and therefore we need to have the right skill set, the right providers to actually support those individuals and the families and the carers in a very safe way, but also in an enabling way that they learn from that. So we'd start to bring some of that stress down and intervene much earlier. So that's a framework we're looking to develop, and Dudley's leading the way on that for the local authorities. The other big piece of work that's taking place within the Transforming Care programme is the development of the Children and Young People's Autism Key Worker, and it is a pilot. We've received £200,000 worth of funding to do that, and that is to provide a dedicated key worker for the young person and the families, and a single point of contact, so they're not being ping-ponged all over the place as previous experiences have led us to understand. They've actually got a single point of contact, a single person that's going to work in that area, and that is the key person that's going to help them navigate the stressful arenas that they experience. That's in its early phase, but what we've done, we've included the SEND colleagues in that, so we're capturing, we've spread it beyond just mental health and adult social care and children and young people. It's actually involving SEND, it's involving wider children's services, so we're taking a much more broader view on that. What I've also tried to capture in the report, Chair, is the citizen's voice, and what the TCP board is very, very good at is actually at every board at the beginning, we invite either a service user or a carer, a parent, to come and tell us their life story, give us their experiences and learning for us. And that is really, really powerful learning for the board, but also it's really powerful for us when we're actually starting to look at service changing, service development, and that has really gone down well. And in the report, I thought it was very important to give you a feel of what it is like for a person going through the system, going through a traumatic life, and then actually coming out the other end of it in a much more positive manner and a much more engaging way. And the case study in there is a really, really good demonstration of how, when we do get it right for people who've been in care for a very long time or in institutions, it is really, really great. The outcomes can be really positive. So hopefully that's giving you elected members a feel of what that's about. What the board also does really, really well as part of the TCP programme, we have Zoom meetings after the board, and they do cover a variety of topics as I've listed in there, and those Zoom meetings are held by DVC with service users and carers, and members of the board attend, and it's a question and answer session and learning for both partners to actually take that away in terms of developing services going forward. In terms of the risks, I've highlighted the risks in the paper, Chair, and there are quite a few, but I think the key point that I absolutely want to land today is that there's a financial pressure here with the TCP agenda. It's the right thing to do, absolutely right thing to do, is to look after people and citizens close to the home and avoid hospital admission. But actually that care, that additional care, sometimes, and I would argue in quite a lot of the cases, is much more costly than a hospital admission. But however, I think it's fundamental we highlight it's the right thing to do, but it is a risk for us going forward. The other risks are listed in the paper. If you want me to go through them, Chair, I can do.
Well, we'll take them as read, I think, Santok.
Okay, brilliant.
Yeah.
Yeah. And the big message here really in the report is that the initial cohort of 62 people that were part of the TCP agenda, we have 11 of those. Those are certainly looked after within the memorandum of understanding. But what's happened is the TCP agenda, because it's successful in keeping people out of hospital, quite rightly, it's now expanded to cover the whole learning disability and autism population. Those individuals that are on the verge of a crisis, on the verge of hospital admission and breakdown, they are pulled into the CTR, Community Treatment Review Programme, and actually we then have the conversation around the TCP, and so the whole cohort has expanded. So in summary, we're in a much better place as a Black Country Transforming Care Partnership. Partnerships are really positive and they're working well. That is professional challenge, but actually there's a common good here, which is the best outcome for the client. Co-production is very positive. We've got real insight and support from Dudley Voices of Choices in terms of shaping service delivery going forward. And the good news is we've got wider children's services in Dudley and SEND involved in the TCP agenda, and that's been a real positive. And overall, I'd like to finish with the fact that the Black Country TCP is no longer on the naughty step with NHS England. We're in a much better position, Chair.
Thanks,
I think that's about it.
Thank you. Any questions from any members? Councillor Jackie Cowell. Thank you.
Yeah, thanks, Chair, and thanks for that, Santok. One question really that stands out is this issue around finance. I mean, obviously I fully understand why might have a problem around that, but in terms of if people could benefit from this, would the plan be to deal with that and sort of sort the money out, if you like, or would it be a case of no, we can't help you?
In all fairness, the client is always the main concern amongst all partners. So the money is always after making sure the client is safe and we've got the right support package. And I can assure you that, Councillor Cowell, I do have discussions with my health colleagues on funding, but it's after the event, after the person is safe and sound. And then for me, that's all bureaucratic. That's something the partners can do after making sure the client is safe.
Okay, thank you very much.
Thank you, Jackie. Any other councillors wish to speak? Councillor Baton, Kathy.
Thanks, Chair, and thanks, Santok, for the report. I've got a couple of questions which mainly focus around page 63 and the risk elements. So what are the capacity risks here? Are we able to meet the projected capacity and numbers going forward? Because you highlight quite rightly that specialist providers in this field are, you know, we're struggling to find quality specialist providers. So what are the capacity risks? How are we going to, or are we going to be working and collaborating across the Black Country in order to effectively source quality providers at economies of scale, I guess? Jackie's also already asked issues around the financial sustainability of the model. But also, you know, I'm aware that for people to be within the community is the absolute right thing to do, and it's the best place for people to be, but acknowledging there will always be the need for hospitalised crisis intervention for short periods of time. So are we assured that that safety net will still be in place in terms of the community model that is being developed?
So I can assure you that where it's appropriate for a person to be admitted to hospital, that is still the case, but it's fewer and far between. And we have to really work with the family and partners to ensure we've got the right support mechanism within the community in order to really be certain the hospital is in the right place at this point in time. But as and when, I can assure you, over the last 6 months, we have admitted 1 or 2 people into hospital, so that does take place. But we're also very good at making sure that that admission is as short as possible, but also the discharge is safe and it's secure and it's in line with what the person themselves want, and also how we can ensure that we create some sustainability of a stability going forward in the community. So we're getting better at discharging people in a quicker manner, but also really better at keeping them out of hospital, but also very clear that if it needs to go in hospital for that environment, we can still have that facility. In terms of collaboration, most of these, I think all of them actually, if I'm looking at them, all the step up, the step down model, the framework, the small bids, that is commissioned, that will be absolutely commissioned across the Black Country. It is a joined up approach between Wolverhampton, Sandwell, Walsall and Dudley. So that's really the essence of this, and that's the only way we can succeed in actually having a sustainable service going forward, that we have much more collaborative working across the patch. In terms of the capacity, that is a risk, and commissioners have assured me that that they will certainly look at the region and locally, and if we're not successful in getting the right providers or interest, then they will expand that search nationally to make sure we absolutely have some success in that. But I think we're also very assured that the small bids support work stream will deliver some really, really good results for us. And I think you have to balance it out with the fact that we don't want huge numbers of providers coming in where we don't actually have that, I suppose, that turnover for them to remain within the market. We also want to have enough providers in the market to actually ensure we meet our local needs. It's a very tricky and difficult balancing act that commissioners are trying to do, but they have assured me that if we don't have success regionally, then we will be looking at a national engagement programme.
I think where I was asking about the collaboration was really around the Black Country authorities collaborating together to either come up with some kind of innovative model around specialist providers, or how you could, what opportunities you would have to procure collectively to perhaps get better contract arrangements and better deals across the Black Country authorities.
That is certainly the conversation that Mubarak, Dudley Commissioner, who's leading on this, is having with his peers across the local authorities. The issue of the model, I think, is really fundamental here, because one of the things I know myself and my peers, that the fellow heads of services have said, we don't want the same old. We've got that now. What we need is a new model that looks at a strengths-based perspective, that looks at independence, that looks at enhancing people's quality of life and some control and choice. So if I go back to my mental health days, we used to have specific models, a bit like the 5-star recovery model. You had very clear areas of need that were monitored and matched and developed. And we want the same for our LD autism clients. That actually there's a model here that looks at enhancing that strength that they already have, but also developing the areas where they need to have that additional intervention, that additional set of skills. So we are very clear that whatever we bring into the local economy here will be absolutely underpinned by a model that works for our clients.
Thank you.
Thank you. Thank you, Santok. Any other councillors wish to make comment, or we'll bring this one to a close? Thank you, Santok. Thanks for the report.
Appreciate it. Thank you.
That's right. Now, there are 6 recommendations. I'm not proposing to read them all out. Do we accept the 6 recommendations as a committee?
Yes.
Yes. Thanks very much.
Yes, sir.
Thanks. And the last agenda item is number 14, the annual overview and scrutiny report. This was produced at full council last Monday and was accepted and passed by full council. Can I just say it's been an absolute joy working on this committee on this last year. And what we need to look at is the very, very last page, 72. And you look at suggested items for inclusion in the network programme. We've seen 1 or 2 additional ones added from this evening, particularly about mental health. Is there anything else that anyone wishes to add to the annual scrutiny report? Hello.
Can I just ask a question about the Nhs Quality Accounts? And we all understand and accept the reason that the quality accounts weren't able to be presented this municipal year. So will those quality accounts for this last year just be written off to COVID, and we would understand why, or will they be retrospective and taken forward, but taking on board the issue that actually the most meaningful part of those quality accounts, where we've got region-wide reporting, are those bits that focus purely on Dudley's data?
I think from having spoken to David Pinchers, who was tearing his hair out trying to get everybody to toe the line regarding the quality accounts, it was difficult for some organisations to extract the Dudley data. I don't know if, Karen, have you just come up? Did you want to add anything to that?
Yeah, just to echo the same point, that was the issue about extracting the data and having that ready in a timely manner. So I think it's correct that we shouldn't lose it. I think it should come to a future. I think it really should come to a future scrutiny committee and extract as much as they can. I do think that's really important. Thank you.
Can I make a suggestion that could perhaps be discussed across partner authorities then? So where we have data, for example, from the ambulance service or the fire service, which is a region-wide, that sits within some kind of either Black Country or West Midlands wide scrutiny process. Now, maybe it's something that is just convened once a year from the various scrutiny bodies, but to make it meaningful and to get buy-in and consult and communication, we need to really think about how we do that.
Thanks, Kathy. I think, Karen, you've been doing some work on this, haven't you?
Yeah, I do think that's a really good approach. That we do see how we can try and join that up together across that footprint through a process. We haven't come to a solution yet, but that certainly I think is the right way forward. Thank you.
Thank you. So, do we accept the annual report then? Is that a yes?
Yes.
Thanks very much. The only thing left now is for me to just to thank everyone. Oh, up here we go. What's happening? Kathy.
I just wanted to take the opportunity, Chair, before we said goodbye tonight, to thank you for your hard work over the last year. You know, you did an extra year that you weren't anticipating having as a councillor, having set your mind to retirement. And I think the fact that, you know, you've embraced this, you've embraced the work of the Scrutiny Committee around the whole COVID response has been outstanding. And I think your contribution in your final year as a councillor is absolute testament to how you've approached your whole career as a councillor. So I just want to place on record my thanks to you for leading this committee over the last year.
I endorse that, Kathy. Thank you, Kathy, for saying that for me.
Yeah. Thank you. Thanks, Elaine. Matt.
I'm clearly tuned into Councillor Baton's timing tonight. So just from the officer side, Councillor Tyler, it's been an inordinately difficult time of it. And I've really appreciated your open door approach, the ability to talk things through with your plan properly and sometimes just download with it all. I think you've been a very fair chair to this committee, and we've got through an awful amount of work. And to put the level of energy and commitment in that you've done at this juncture after everything else you've done from the council speaks volumes about your contribution and your selflessness. So sincere thanks. I've really enjoyed working with you. The only positive thing about your departure is it's one less Liverpool fan on the council, which I'm sure the rest of us would all agree is a very good thing.
No, not everyone. There's another one sitting there somewhere.
Yeah, just be careful what you're saying there, Matt, please.
Thank you, Steve. Thanks for getting my back. All right. Can I just say from a personal point of view, I've had some really good years on this council, but as far as council work is concerned, I mean, I was mayor, I was deputy mayor and mayor, and as a local councillor, that's the ultimate accolade you can get, being elected by your peers in your own village. But actually, as far as it comes down to council work, I can't think of a more enjoyable year in my council life, council work-wise, than this last year. I really do feel like, as a team, we've actually done some really useful work. And not only that, what we've actually done, we've set health and well-being and adult social care and the NHS trusts. We've set them up. I think we've set them up to work as an unbreakable team for the future. And I've got to thank everybody on the committee, and not without the support of the incredible Helen, who's been our clerk from day one. And I hope she's enjoyed every minute, and I'm going to ask her to agree with me whether she has. But Steve as well has been like someone to bounce ideas off. But our senior officers on Dudley Council, I think we have got the cream of the crop when we come to health and adult social care. It is absolutely amazing, and I've enjoyed every single minute of it. So it's goodbye from him. And to consider any questions from members to the chair, where 2 clear days' notice has been given to the monitoring officer under Council Procedure Rule 11.8 for the very last time.
And there's none, Chair.
Thank you, Ellen. Thanks for your support as well.
Thanks, everybody.
Thank you. Thank you.
Thank you.
Thank you. Best of luck, Chair.
Yeah. Well done, Dave. You've done a great job. Yeah. Thank you.
In fact, as a final comment, perhaps we'll invite you back next year as a scrutiny expert, Dave. How about that? Come out of retirement.
I'm doing nothing else anyway, Steve. All right. Thanks a lot.
Thank you.
Thank you. Thank you all.
Bye.